ECG in 60 seconds. Master it before exams. Hey future nurses and doctors, let's crack the ECG in just 60 seconds exam style. First, understand the basics. Before knowing the abnormal strip, we must need to know the normal ECG strip or graph. The P wave represents atrial depolarization, meaning the atria are contracting. The curve's duration should be less than 0.12 seconds, and the QT interval should be less than 0.44 seconds. And remember to correct QT for hour. The curve's complex represents ventricular depolarization, meaning the ventricles are contracting, and the T wave represents ventricular repolarization, meaning the ventricles are resetting. The curve's complex represents ventricular depolarization, meaning the ventricles are contracting, and the T wave represents ventricular repolarization, meaning the ventricles are resetting. If there are no P waves, think atrial fibrillation. If you see peaked T waves, think hypercalcemia. If you see a wide curve, it may indicate a ventricular origin or a bundle branch block. And if you see ST elevation, suspect an MI and call for help. Next, know the normal time intervals. The PR interval should be between 0.12 and 0.2 seconds. Then lead placement. Remember this image? The limb leads are RA, LA, are Landau L, but if it's greater than or equal to 0.12 seconds, it suggests that there's something abnormal happening in the ventricles. Wide curves indicates delayed ventricular conduction and is often associated with serious arrhythmias. It needs immediate evaluation, especially if the patient is symptomatic, and the chest leads are V1 to V6 across the precordium. V1 is at the 4th ICSOSP and V6 is at the mid-axillary line. Next, know the patterns that can help you identify key things on the ECG. The ECG tells a story, you just have to learn how to read it, and remember the mnemonic: if it's wide, it's bad. Lastly, focus on rhythm, rate, intervals, and wave patterns. Be sure to like, save, and share if this helped you master ECG like a pro.